Well, here we are, everybody. Welcome to this fourth seminar in Learning Together for Better Lives. I am Fanula, I'm your host. We have two speakers today, but before I hand over to them, I wanted to do a little introduction and some housekeeping. So this is coming to you from the Health Determinants Research Collaboration Aberdeen. Our mission is to support Aberdeen City Council in maturing its research and evidence-based decision-making. Some housekeeping then before I pass over to the speakers. This session is being recorded and it will be published on the Community Planning Aberdeen YouTube channel. For now, everyone but the speakers is muted. But when the speakers get to the Q&A portion of the seminar, I will change the settings so you can raise your hand and unmute yourselves if you want to speak your question. Equally, there's a Q&A function enabled, so you can drop a written question into Q&A at any point, and you can also just write your question at the Q&A section of the seminar as well. I will coordinate which written questions are posed to the speakers at any one time, but equally, you can raise your hand and just speak your question out as well. Our topic today is evidence, specifically the importance of evidence and evaluation. Our speakers are Professor Miriam Brazzelli and Dr. Sarah McGarrol. Miriam is with the University of Aberdeen and the Health Determinants Research Collaboration. Within the university, she is particularly Professor of Health Services Research at the Aberdeen Centre for Evaluation. So, perfect person to be talking to us today about evaluation. Sarah is a Senior Research Fellow in the Health Determinants Research Collaboration. She brings over 20 years experience in social and public health research, and she's currently focusing on the social determinants of health and health inequalities. She's doing that, supporting the HDRC mission of supporting ACC in maturing its evidence decision-making. So that is my intro. I would love to hand over to Miriam right now. Thank you.
Thank you very much for the introduction. And as Finula said, this presentation will be on the importance of assessing evidence and conducted evaluation. I will start just to provide an introduction of how to conduct evaluation and present the different types of evaluation, and also how we can assess and evaluate intervention using both primary studies, primary research, and also systematic reviews. So first of all, we can start just to define what do we mean by evaluation. Evaluation is the systematic and objective assessment of an ongoing or completed project, program, intervention, or policy, including its design, implementation, and of course also its findings. Why we conduct evaluation? Most of the time we conduct evaluation because, for example, we wanted to assess whether the objectives of an intervention or program that we have developed have been achieved. In other terms, we wanted to assess the effects or impact of our intervention or program or policy. We want to know what works well and what doesn't work well, because we want to learn from our successes and also from our mistake in order to modify maybe the intervention or program, and also to plan future intervention and policies and programs. There are three main types of evaluation: formative evaluation, process evaluation, and outcome or impact evaluation. The formative evaluation involves gathering data to help inform the development, the delivery of an intervention or program. So the formative evaluation tells us how to design an intervention and program. The process evaluation instead are used to understand the function of an intervention, examining its implementation, mechanism of impact, and contextual factors. So the process evaluation tells us how an intervention works, provide information about the feasibility of the intervention or characteristic of the implementation of the intervention, and for whom the intervention is intended to. There is a very good UK MRC guidance that provide a lot of details and information about the process evaluation and how to conduct the process evaluation, if you are interested in. And finally, we have outcome or impact evaluation. The outcome evaluation is mainly to assess the changes or effects that result from a specific program of intervention. So the outcome evaluation is used to assess whether the program or intervention is effective and to assess the impact at long and short term. Intervention, the evaluation can be conducted at different type of levels: individual level, family, household level, community level, or city level. And as we move from individual to city or population level, the complexity of evaluation increases. And for this reason, we have usually more evaluations at an individual level because it's easier to conduct at this level, and we have fewer evaluations at the city level or population level. What we need to consider before planning an evaluation, if we want to conduct an effective evaluation, there are different elements that is important to keep in mind. First of all, we need to know what we want to evaluate and why we want to conduct an evaluation. So our objectives should be clearly defined. We need also to consider the resources available, and not just the resources in terms of money or funding, but also resources in terms of, for example, availability of staff and the expertise of this staff, because we need people that they know which kind of research method used to conduct an evaluation. And finally, we need also to consider our timelines, which time we have available, how much time we have available to conduct the evaluation. Then we need to define our target audience who will be affected by the findings of the evaluation. We need to keep this in mind and to define this clearly and to know who will the evaluation be for. It's important then to consider the existing knowledge about the topic that we want to evaluate. What has already been done on this topic? Which evidence already exists? Because in some time, maybe that we can discover that it's not necessary to conduct an evaluation if there are already existing evidence on that topic and enough knowledge or an established knowledge. And finally, we need to know that our theory of change, how the intervention is intended to work, in which way it will produce the outcome that we are expecting to assess and find. So all these elements are important when you plan an evaluation, and also are important if you need to prioritize between different type of evaluation. In sometime different organization, maybe that they carried out a number of evaluations of intervention and programs. And if you need to decide which one it's important to prioritize, maybe that you want to consider these elements, the objectives, and in particular the resources. In some cases, you can have maybe a clear objectives, clear target audience, you know existing evidence, you know your theory, but you have very limited resources. So you know that maybe the evaluation is not practical or not feasible. When you start to evaluate an intervention or a program, you need to start with a clear, specific, and answerable question. And usually we define a research question using what we call the PICO criteria. And PICO, the P in PICO stands for the problem that we want to study, the issue that we want to tackle, or in some cases, the population or patient. What is the problem? What is the target population? The I in PICO stands for intervention or initiative, which intervention we want to evaluate. The C stands for the context. What is the current context? What is the current practice? Or what is the alternative intervention, the comparative intervention, if I wanted to evaluate a different type of intervention. And finally, the O in PICO stands for outcomes. What are the effects of the intervention that I wanted to assess? Again, then we need to find out what has already been done. So we want maybe to review the current literature published in gray literature to see which evidence already exists. And also we need to know the theory of change, as I mentioned before. And finally, we need to decide the best research method to use to evaluate our program, intervention, or policy. And in terms of research method, this depends on the type of question that we need to address. So if we wanted to assess, for example, the extent of the problem, in this case, we will use epidemiological research, and we will use data from surveys, observations. If we want instead to evaluate whether the intervention is effective, what works, we will use intervention evaluations, and we will collect data using primary studies, primary experimental studies. If we are interested instead in assessing the barriers and facilitators of implementation and feasibility, for example, we use, as I mentioned before, process evaluations, and we collect data using surveys, stakeholder analysis. And finally, if we want to know what these people's experience or people views or perspectives, we will use qualitative research methods, and we will collect data using surveys, focus groups, interviews, and documentary analysis. So according to the purposes of our evaluation, we will have different type of research evidence that we can collect. And these are just listed to repeat: the experimental evidence from comparative studies or randomized control studies, quasi-experimental observational evidence, and I will provide some example in a few minutes, qualitative evidence to assess experience, acceptability, and processes, and finally documentary evidence, historical evidence, or case studies. Most evaluation are outcome evaluation, and by outcome we mean the measure used to assess the result of an intervention or program. It's used to decide whether the intervention is effective, as I said before, and intervention initiative programs are designed to produce or to change a variety of outcomes. So we can have, for example, intervention that aim to increase knowledge and awareness, or assessing the frequency or prevalence of an event or a condition, or promoting attitudes, changing behavioral patterns, changing use of service, improving health and well-being, or reducing inequalities. So these are examples of possible outcomes. And when we develop and design an evaluation, we need to define our outcomes, which outcome are more interesting, we are interested in. Outcome evaluation. So if we want to evaluate the effects or the impact of a specific intervention and program, we can use the data from primary studies, from different type of, and we can use different design. For example, we can use an after-only design, before and after design, interrupted time series, or control group design. So I will provide some example of these studies that can be used to assess the effect or impact of a specific intervention. The first one is the after-only design, as the name and title say. This is an assessment after the intervention, when the intervention has been completed, at the end of the intervention. So we have a variable that we want to evaluate over time. At a certain point, we have the intervention. We assess the intervention after, at the end, post-intervention. The example is if we want, for example, to evaluate a mass media campaign to promote HIV testing. We will do this at the end of the campaign. When the campaign is finished, completed, we will do the assessment. And we can assess using, for example, a population-based survey to find out whether the campaign increase awareness, and we can ask the participant, for example, if they could remember the content of the campaign, if they have changed maybe behavior because of the campaign, and we can do this at the end. What are the strength and limitation of this design? It's quite a simple, quick and expensive type of evaluation. You do an assessment after the intervention has been completed, but the problem is that it's difficult to establish causality because you have just data and assessment after the intervention has been completed. You cannot compare with something before, with what we call the baseline data, so how the situation was pre-intervention. And it is always difficult also to establish whether what you see after the intervention, the assessment, is due to the intervention itself, or if it's due to other confounding factors that can maybe have an effect. So it's difficult to separate to single out the effect of an intervention for background trends, for example, or other confounding factors. And in particular, as I said before, sometimes it's more important to have an assessment of the baseline, the previous situation, baseline data versus post-intervention data. And in this case, the next type of study design will be a before and after design. That is an improvement compared to the after-only design. In this case, again, I have the variable that I wanted to evaluate, I have over time, I have the intervention at a certain point in time, but I collect data before the intervention and then I collect data after the intervention. An example is that all these examples are a proper example from the literature, has been published. There is article on all these examples that I'm presenting in these slides. So this is the citywide Edinburgh 20 miles speed limit intervention. They did a pre-post observational evaluation. They collected the speed and traffic volume data for 1 full week pre and post the policy of the 20-mile speed limit for 66 streets in Edinburgh. And what they found after when they assessed and compared the result before and after, they find that after the 20 miles speed limit policy, there was a reduction in speed, but not a significant reduction in traffic volume traffic in the 66 streets in all the data that they collected for a full week. So this is a good example. And what are the strength and limitation? Again, this is quite easy to design and implement. It's quite good for real world evaluation, like the one that I presented here, the example of the 20 miles speed limit. Again, cannot strongly establish causality. It's difficult to control again for external factor because it's possible that sometimes you observe an event, like in this case, a reduction in speed. The problem is that we need to be sure that the reduction in speed was only due to the intervention. For example, if at the same time in which this policy was put in place, there was maybe other changes in the, for example, traffic light or numbers of bumps in these streets. So you can have a reduction for other factors that are not necessarily due to the speed limit. But in this case was quite clear that was due to the policy. So, but it's important to control for external factor. There is also another phenomenon. There is also sometimes random fluctuation in the score or result or assessments, what we call the regression to the mean. Sometimes you can have an extreme result, an extreme data or outcome, and then is followed by a less extreme outcome, even if nothing has changed. And we called this a regression to the mean because the less extreme outcomes moves towards closer to the average to the mean. So we called regress to the mean, but is a statistical concept that can explain the natural variability between assessment or the random fluctuation. And it, again, is something that we need to take into consideration when we analyze this data. And also another possible bias is what we call the measurement bias. So when we measure the criteria that we use or the tools that we use to assess the data pre-intervention and post-intervention should be the same, because if we change the measurement tool or criteria, of course, this can bias the results. Very easy to think about, for example, intervention to reduce obesity in school children. And then we wanted to assess whether the weight of children before and after. But if we use, for example, different scales that are calibrated in different way, of course, we can have maybe biased results. The next in some cases, this is a before-after. As I said, we have one assessment before, one assessment after. In some cases, you can have multiple assessments before the intervention and multiple assessments after the intervention. In this case, we called interrupted time series because it requires multiple assessments before and multiple after. The multiple assessments before are useful because they give us also an indication of the trend before we put in place the intervention, and then we can use put in place the intervention and then assess whether the previous trend has changed because of the intervention. Again, an example, several examples that are published in the literature about the impact of seatbelt legislation on road traffic injuries, in which they checked monthly traffic injuries and mortality data multiple times before they put in place the legislation and after the legislation. And again, strength and limitation. The strength in this case, because you have multiple assessment before, multiple assessment after, you can provide a strong causal inference of the effect of the intervention. You can control for existing, as I said before, pre-existing trends, and you can distinguish between immediate and long-term effects. Again, weaknesses always, also this type of study design can be affected by confounding or contextual factors, so always to take into consideration potential confounding factors. One of the challenges for the interrupted time series that you need a sufficient number of time points before and after the intervention. And sometimes this can be challenging because it's time consuming and it's quite resources intense. Again, there is a potential measurement bias if the measurement, the way in which you conduct the measurement changes over time or pre and post intervention. And the next study design is what we consider probably the best study design for assessing the effect of an intervention. Is an experimental control design in which we have in this case two groups, one receiving an intervention and one that doesn't receive an intervention, is acting as a control group. And we do assessment before the intervention is put in place and after the intervention. And we compare the result between the two groups, intervention group and control group. An example is, for example, a control trial of a peer-led intervention to prevent smoking in schools. This has been again published, is called the ASSIST trial, and the program consisted of training popular, influential students to act as peer supporters during informal interaction outside the classroom to encourage their peers not to smoke. So the intervention, and in this case, they randomize different schools to receive the intervention, to receive this peer-led intervention to prevent smoking, and other schools were randomized to the control group, in which they didn't receive the intervention, they received just the usual information about the risk of smoking, and then they assess the results at the end. This is again, strength is the best for a causal inference. You have a control group, you have a good statistical power, and is a widely accepted method to assess the effect of policy of interventions. The weaknesses can be quite expensive and time consuming. You need also there are also some ethical considerations to take into account, especially when, for example, you don't provide any treatment or support to the control group. So you need to be sure that this is acceptable. One possible bias that you need to take into consideration is that you can have a different dropout rate between groups. These kind of studies, you have always participants that they don't want to finish the study, so they drop out, they withdraw from the study. And the dropout rate should be similar between intervention and control in order to have a reliable result. Otherwise, if you have differential dropout, it can be problematic. And also there is what we call the risk of contamination, because the control group, the intervention and control group should kept separately. So the control, they shouldn't know about the intervention, and they shouldn't interact with the participant in the intervention group. If this happens, you can have a contamination. For example, if someone from in the control group receive information about the peer-led intervention, or if they talk to someone in the intervention group, of course, this can affect the assessment. So these are the main study design that we can use to assess the effect of an intervention using primary research studies. There are the general problems and limitations. always consider external factor because they can influence the result or changes. Consider also how the outcome of interest can change naturally over time or fluctuate over time, and the possible changes also in measurement tools, procedure, or condition. We need sufficient data and enough data to provide a reliable conclusion, and this is particularly true for the interrupted time series, but also for the experimental control studies. At the end, we need a sufficient sample of participants. And also we need to know how to analyze this data, because some of these analyses are quite complex analysis. So we need to have the right expertise within the evaluation team to conduct this kind of analysis, and also to know all the limitations that we are facing. So this was we talk about some evaluation to evaluate effect using primary studies, but we can also evaluate the effect of an intervention or program or policy using a result of studies they are already available in the literature. And in this case, we conduct what we call the systematic review. So we review the systematic review is the systematic collection, analysis, and interpretation of the best available evidence to answer a specific question. So we know that, for example, there are already a number of studies that have assessed the effect of the effects of an intervention, and we want maybe to collect this information from published studies already. And in this case, we conduct a systematic review. Systematic reviews are very common nowadays, and they rely on specific research methods. So there is a core method for conducting the systematic review. First of all, we need to have a clear research question again. We need then to identify existing evidence studies in the literature, both published and gray literature. So we need to conduct comprehensive search strategies. And for doing this, we need to develop the search strategies. And usually it's important maybe to rely on the expertise of librarian or information scientist, because to develop effective and comprehensive search strategies can be quite challenging sometimes, and you need to know the methods for doing this. And you need to know how to search different electronic databases in order to identify your studies. Once you have identified your studies, and you have the results of your research strategy, you can select the one that meet your inclusion criteria and are useful to address your research question. So you need to select the studies, and then we need to appraise the methodological quality of these studies. For the appraisal of the methodological quality of these studies, because we want to know whether these studies are robust, reliable, or if maybe that they provide weak evidence or they are not so well conducted and robust. Usually there are a number of checklists and tools that we can use according to the study design of the design of the studies that we have identified in the literature. And there is a checklist and tools for different type of study design. Once we have appraised the methodological quality, so we know we have selected the studies, appraised the methodological quality, we can extract the data from these studies, and we can conduct a synthesis of results. So we can conduct a quantitative synthesis, so we can combine the results of these primary studies in a mathematical synthesis that we call the meta-analysis. Or we can conduct, for example, a thematic synthesis if we have qualitative evidence. So result from surveys or focus group or interviews, we can analyze these using thematic analysis for qualitative research. Or we can have mixed method approaches that combine both the quantitative and the qualitative data. And finally, we need to interpret the result in a critical way. We need to know the limitation of the results that we have combined in our systematic review, and we need to decide whether they can be applicable and generalizable to practice. There is different type of systematic reviews that they have use a slightly different research method. We can have a systematic review of the intervention, rapid reviews, scoping reviews, review of qualitative evidence, meta-analysis mainly on mathematical synthesis, overview of reviews, reviews of economic evaluation, and mixed method reviews. As nowadays, most evaluation use mixed method approaches because, as I said before, you can easily combine quantitative evidence with qualitative evidence, and you can integrate these two type of synthesis. And just to provide an example of a mixed method review is this review conducted by the Campbell collaboration, that is a collaboration that look at social care intervention, and they look at the effect of aftercare resettlement services on crime and violence in young people. And this was a mixed method because they collected information on the impact of aftercare resettlement programs on crime-related outcomes, but also, and they wanted to know which intervention was more effective in reducing crime and violence, but also they look at the barrier and facilitator to effective program implementation. So they look at the process evaluation. They consider the theory of change underlying resettlement intervention, and they wanted also to assess the cost. So it was a very comprehensive type, again, publishing in the literature, and you can see, you can have a look at the details if you look at the literature. So this is a typical example of a mixed method approach that you can use to tackle a specific problem, in this case, the effects of aftercare or resettlement service on crime and violence. But you can have different type of systematic reviews in assessing different type of evidence. Similar, for example, you can have reports, and this is on a similar topic, reducing reoffending among young adults and young people. Again, this is a systematic review, a synthesis of evidence, and looking at the effectiveness of different intervention to reduce reoffending. This was published by the Ministry of Justice, and they use a different they didn't use a mixed method, they use a series of what they call the rapid evidence assessment that we called like rapid reviews, but they also conducted some meta-analysis of results according to the evidence that they found in the literature. And also interesting, they assessed, as I said before, is important in systematic review to assess the strength and the confidence in the result of the studies that you find in the literature. They assess the overall strength of the evidence base, and they use three different, they use good overall strength, mixed, promising, or insufficient. And they present the result using a table in which they provide some intervention. This is just a screenshot. There is several pages of presenting different type of intervention. And they present a different type of intervention, the overall strength of the evidence, whether it's good or insufficient, the type of intervention approach. They give also an indication of the scale of the reduction in reoffending, so the magnitude of effect is in some way summarized here. And also important, they provide the source of evidence, whether the source was a good source like a meta-analysis, or whether it was not applicable because there was no source, or whether it was maybe another type of studies. So this is another way in which you can present, you can assess the effect of different intervention for a certain topic, in this case reducing reoffending, and is a good way in which you also want to provide information about the strength and the confidence of the evidence. So to sum up, just the decision should be based on robust and reliable evidence, and we all agree on this, that decisions are important, but the evidence that we use to inform our decision should be reliable. So evaluation should be properly designed. It's important to specify a clear question, and I always want to stress the point that if there is no clear question, it will be very difficult to produce clear conclusion. If you have a very broad or well not defined question, it will be problematic and messy to reach clear conclusions. It's important to identify objectives from the start, to define outcomes, to know about your resources, and then you can consider the advantages and disadvantages of different type of study design, approaches, and method in order to decide how to conduct your evaluation. So there are key elements to consider when you want to conduct an effective evaluation. So plan ahead, as I said already, clear defining objective, resources and timeline, describe the intervention thoroughly, consider the aims, the target audience, how the intervention will be delivered, the method that you can use, the context. Use also multiple data sources. It's important not to just use some data sources and not others. We need to be comprehensive in the time of evidence that we want to collect. And sometimes it's better to collect both qualitative and quantitative evidence. It's important to have a good evaluation team with a range of expertise in different methods, knowledge of the field, relevant theory and context. It's also important to engage during the evaluation process with relevant stakeholders. In this, the stakeholder can include collaborators, partner, member of the public, expert, decision makers. It's also important to not to overstate or inflate your conclusion, but base your conclusion on what has been measured. So what are your outcomes and in which way has been measured? So it's important not to try to expand or inflate the conclusion, but just to ensure that findings are linked to the data that you have assessed. Consider different type of outcomes, as I said before, whether we want to assess changes in knowledge or awareness or understanding or changes in behavior or health outcomes. And also, it's important to disseminate a result appropriately and effectively. Share findings is very important. Sometimes people, they conduct evaluation, but they don't share their findings. Instead, we should share findings with relevant stakeholders in order to inform practice, policy, and of course, future research and intervention. Things instead that is important to avoid. Avoid to be selective in using your evidence. Don't cherry pick only positive or supportive result or findings, but also consider the negative findings as well. So you need to consider the complexity and the comprehensive type of results. Cherry pick is a typical mistake that sometimes happen when you do evaluation. There is a tendency to look just at the results that we were expecting or they are positive. Don't design unrealistic evaluations. Sometimes it's nice to be ambitious and to have great plans, but the problem is that they should match our resources and purpose. If we don't have enough resources, we cannot design very broad evaluation. We need to be pragmatic and realistic. So we don't need to commit to more that is achievable. We need to stay within our expertise, time and capacity. And as I said before, we need to avoid overstating results, interpret findings cautiously in a critical way, and we need to acknowledge limitation because we can learn from the limitation and we can design future better evaluation. So evaluation need to be properly planned. We need to have a good and a strong team and with the right expertise, but evaluation can be intense, time-consuming and challenging. I will now provide an example of the work that we have done within the Health Determinant Research Collaboration Aberdeen. And just a couple of examples, and then Sarah will be expand on in the way we have used these results. So I provide an example of a couple of systematic review that we did to evaluate some interventions, and then how we have used this kind of data, and Sarah will expand on this. So the first one that I wanted to present is the assessment of the needs of asylum seekers, and we assess the health and social care needs of asylum seekers in high-income countries, their experience in particular and challenges in accessing care service in the host country. We did we look at the literature, we found already systematic reviews, so we collect the result of this systematic review and we produce an overview of systematic review that has been published this year in the Journal of Migration and Health. And it's interesting to see the common themes that we identify in terms of, for example, communication, language, problem, challenges that this asylum seeker faced, and also the attitude of health professional and the relationship between asylum seeker and health professional, and also other barriers that they had to deal with, included like relocation, poor housing, and difficult living condition. And so Sarah will expand in a minute. And the second example is instead another review looking at intervention to mitigate food insecurity, infant food insecurity in high-income countries. That is becoming, infant food insecurity is becoming a critical issue also in high-income countries. And we look at possible interventions that were put in place to mitigate this type of problem. We found so only limited evidence. All this evidence were based on intervention and a program that could help assisting families or improving the food practices, were all based in the United States. We didn't find any evidence from UK, for example, and this was useful also to highlight an important gap, research gap in the current evidence-based, and maybe to develop more effective strategies for the future. So these are the two examples. Maybe I'll pass on to you, Sarah, now, if it's okay with you. Can I just move to the slide?
Yes, please. Thanks, Miriam. Thanks so much. That's great. Yeah, as Miriam said, I'll expand on and outline how different types of evidence can be used in different ways to highlight a pertinent issue or topic. And I'll draw on the needs of asylum seekers and the infant food insecurity work that Miriam's mentioned, and show how the work in the HDRC is using evidence reviews and evidence briefings in a particular way, drawing together lots of different types of evidence and its influence and its impact. So first up, the needs of asylum seekers. I've put this like a kind of research journey just to kind of explain where this came from and where we've ended up from sort of inception to conclusion. So initially in September 23, one of the first pieces of research conducted by the HDRC came through from our co-director, Professor Shantini Paranjyothi, who expressed concerns about the anticipated increase in the number of asylum seekers in Aberdeen and our inadequate understanding of their health and social care needs. So an evidence review to identify these needs and experiences of asylum seekers in high-income countries, as Miriam said, was proposed to provide evidence to support decision-making at Aberdeen City Council, to provide the background and the evidence base, and also how this could be used by other partners, so for example in NHS Grampian. So this resulted in the beginning of this overview of systematic reviews to be conducted. And around the same time in October 2023, we had discussions internally as at HDRC Aberdeen around some of the thoughts and preliminary findings we were coming up with around this overview, and whether we could conduct a local primary research study, if that would be of use, with ACC officers involving asylum seekers, just to add to the evidence base anyway, and particularly locally. So we engaged with officers working with asylum seekers in Aberdeen to understand their scope of practice, and crucially to seek their input, and which helped to solidify some of the work around our review as well from their perspective. But after several discussions, the officers advised us against conducting a primary study to avoid re-traumatising this vulnerable population. So we continued apace with conducting the overview, and then we were connected with members of NHS Grampian's Asylum Seekers Working Group through our HDRC Aberdeen co-applicants in February 24. And this engagement allowed us to understand the current research efforts concerning asylum seekers in NHS Grampian and to explore potential collaborations with them. We were then invited to attend and present the overview findings at the NHS Grampian's Asylum Seekers Working Group meeting in July 24. And around the same time, the overview of reviews article, the one that Miriam has showed us there, was submitted initially to the Journal of Migration and Health. But crucially, the evidence from this overview of reviews was included as part of the evidence considered by NHS Grampian's Public Health Asylum Seeker Short Life Working Group. These are not quickly articulated titles for compiling a health needs assessment for asylum seekers locally in Aberdeen in September 2024. So the assessment reached its conclusions through the evaluation of data about the health needs of asylum seekers and migrant populations, drawing on the evidence that was there, provided through the HDRC's overview of the review evidence. And they also included and examined other primary and grey literature, reviewed the findings of local qualitative research, and cross-referenced data from healthcare records in NHS Grampian to establish patterns of service use. So the assessment made recommendations based upon data sharing and healthcare needs of the asylum-seeking population, particularly those living in communal accommodation in NHS Grampian. And HDRC was consulted for input during the compilation of this needs assessment. Following on from the presentation the HDRC provided at the working group meeting and the inclusion of this evidence in the health needs assessment, during our conference, our HDRCA conference in October 24, HDRC researchers co-designed and presented work on asylum seekers with members of the NHS working group and ACC officers. This was well received and demonstrated how local, national and international evidence from various sources, as well as the relationships and collaborations across organisations, can be established to better understand an identified local issue and use evidence to make relevant recommendations. In addition, the overview of systematic reviews, as Miriam showed, was published finally, it took a long time, in the Journal of Migration and Health in August 2025. And in addition, with other members of the HDRCA team, findings from the review were included in a short video on asylum seekers' health and social needs released in 2024 and is available via HDRC's page on Community Plan and Aberdeen's website. Next slide, please, Miriam. As Miriam outlined too, we also were doing some work around food insecurity, and Miriam mentioned the scope and reviews that were published on infant food insecurity. But this evidence formed part of a wider food insecurity evidence briefing. And this evidence briefing was an overview of all the work conducted by numerous colleagues from the HDRC and others on the broad topic of food insecurity during 2023 to 24. So, for example, 2 scope and reviews were conducted on infant food insecurity and published in academic journals in 2024 and 25. And one of the papers was accepted and presented as a poster presentation at an international conference in 2024. The HDRCA team completed a comprehensive service mapping exercise of emergency food providers in Aberdeen City. And this exercise aimed to identify local services addressing food insecurity and identify gaps in provision. This included mapping the number of organisations providing emergency food assistance to those in need. And during 2024, when the exercise was conducted, we established that 42 existing providers across Aberdeen City were doing so. The HDRC team also were working out and developing work to visualise and map the emergency food providers identified through the above service mapping exercise. And also, in addition to these separate pieces of work, within the evidence briefing itself, there was also a definition of food insecurity provided, the importance of infant food insecurity, drawing on the published work mentioned before, and the food insecurity policy context in Scotland was outlined, highlighting the Scottish Government's recognition that food insecurity stems from inadequate incomes, necessitating measures to address this issue through a variety of policies and strategies, with a focus on increasing household incomes, reducing costs and ensuring access to nutritious, culturally appropriate food. And then we turned our attention also within the evidence briefing to understanding local food insecurity in Aberdeen in particular. We provided evidence on the types of interventions in place locally to mitigate food insecurity in Aberdeen, and this was collated with colleagues in Aberdeen City Council providing further data on interventions and more details around them, as well as colleagues from other organisations such as the Community Foods Initiative North East CFINE providing their data on emergency food provision and the numbers of people who were receiving this assistance. Combining all of these evidence sources, recommendations for future work were made and included improving the uptake of free school meals across the city, strengthening efforts to increase household income in food insecure households, especially families with pregnant women and children 0 to 5 years in particular, and the need to improve quantitative and qualitative data, as well as data accuracy in reporting food insecurity, especially for mothers and infants. In an evidence report such as this, in a report of this nature, numerous sources of data, evidence, insights and research expertise are required to synthesise all of this information. And other than the named briefing report contributors listed there on the slide, HDRCA colleagues contributed in numerous ways, including on the report's design, formatting, editing, publishing, and wider dissemination activities. The final report was published this month in October and is available on the HDRC link. I think Brunela's put them up there. And in addition to the main report, we've also created a short one-page summary of the briefing, an infographic highlighting key findings and key points, and a short video focusing on food insecurity in Aberdeen and highlighting the response to food insecurity in the city. In addition to this, we're undertaking some further dissemination at the moment through HDRCA's team's contacts, and we've seen the evidence reviews sent to local and national organisations such as Food Standards Scotland, the Scottish Government Population Health Directorate, Sustainable Food Places Partnership Aberdeen, and the ACC Good Food Nation local planning team as well. The main briefing report was uploaded to HDRC's Aberdeen LinkedIn page, resulting in over 1,200 impressions. 1,200 impressions, I should say. I already said that. Although it's only recently been published and its reach should increase, this briefing has increased the number of people following HDRC Aberdeen's work and resulted in tens of reactions, comments and reposts. It's already made its way to both local and national organisations, and invitations to present this work have been requested by colleagues in the Scottish Alliance for Food. Next slide, please, Miriam. Further to the work conducted on asylum seekers' needs and the food insecurity work that I mentioned, we've also been conducting some work around profiling, neighbourhood profiling. So from April to October this year, we developed a novel approach to neighbourhood profiling, focusing on Northfield, a previously identified priority area. This profile was compiled to explore the complex relationship between geography and health, and it presents the challenges of defining neighbourhoods for research and planning purposes, and reviews current profiling tools and presents current available statistical evidence that would usually be included in neighbourhood profiles, although what is included in neighbourhood profiles is not exhaustive, nor is it particularly defined. But our profile presents key statistics themed around the 5 social determinants of health thematic areas used by Aberdeen City Council and builds on existing work by Community Planning Aberdeen and the Collaboration for Health Equity in Scotland around neighbourhood profiling. We reviewed relevant published literature, synthesised open data, that is publicly available data, and presented spatial insights about Northfield, including green space, open space, services, etc. We combined these sources of evidence uniquely, I think, with qualitative findings from the recent public consultation, Your Plan, Your Place, Your Plans, Your Future. And using multiple sources of evidence to develop a profile as we have done aims to provide a more comprehensive understanding of a neighbourhood for stakeholders and policymakers, allowing identification of areas for improvement and future opportunities, not only for further research, but for developing relevant place-based interventions and for decision-making. In addition to the main Northfield report, we have also produced a wider range of formats. We wrote a highlights document pulling out and presenting the key statistical findings from the full profile document. And we've compiled a how-to guide about how we composed our neighbourhood profile with the intention for others to see the steps involved and the types of evidence that we used, so that they too, if they so wish, can compile a similar type of profile. This work is currently available via the HDRC page on Community Planning Aberdeen's website. A post will be forthcoming on the ACC intranet this week to update some of the links, and we'll further disseminate to relevant contacts and organisations in due course. But I hope this has given you a flavour of how we use evidence and what the purpose is for the HDRC and how we use it at the HDRC. And if there are any questions, then please do get in touch. But I'll hand back now to Miriam. Thank you very much.
I think that we have reached the finish of our presentation, so we can open the floor to questions if there are questions.
Ace. Fab. Thank you so much, Miriam and Sarah. So what I'm going to do now is I will give everybody the power to unmute yourself to ask questions, but also there's a number of questions already written in, so bear with me while I tap to give you the power. And then I will point us to the particular questions. Apply. Okay. If you have a question you'd like to ask verbally, feel free to raise your hand, but for now I'm going to go into the ones that have been written already. And I'm going to do them in a strange order because a couple of them relate, I think, to the evidence at the projects and how they've been used, them that you were specifically talking about, Sarah.
Okay.
So these come from Bob Farthing, and Bob, do correct me if I've misunderstood here. Now, I think this first question, I think you shared it when you were talking about the food insecurity evidence briefing. So Bob's question there is, as an example, how will the conclusions of the research relate to, for example, a single mother living in Tillydrone, and how would she engage with this?
It's a good question. I think the purpose of us doing this kind of work is to synthesize what we know and for it to be cascaded to others that can use it. I mean, we published this on our HDRC website, and it is available for the public to access and to see it. It should relate in the sense that we would know more about certain populations and what's happening in our city, and it provides a kind of a way to show the current available evidence and provide strong recommendations on the basis of that evidence for what ought to happen next. I suppose research, and Miriam might agree here too, but I mean, research is there to be there anyway, to provide the most up-to-date evidence, and for us to influence how, or for it to be used by decision makers. Obviously, we know that our colleagues in Aberdeen City Council have had sight of this and these documents, and we hope therefore that they will be considering this too.
Yeah, and that relates to Bob's other question, which is about the outcomes of research being incorporated into the local outcome improvement plans and locality plans. Bob, I see you've also raised your hand. Would you like to expand on your question or otherwise comment?
Can I just, sorry, reply to Bob's one about the research incorporated into the local outcome improvement plan? I mean, research is used often anyway, but we've specifically done quite a lot of work recently in the HDRC reviewing evidence around interventions, and we've been in touch quite strongly with our outcome improvement groups and who are developing their plans at the moment. So we've provided them with evidence reviews and evidence reviews of interventions from the published evidence, as well as some of the grey literature and other works that have been done. And we've been feeding that back, and they're considering that now as the LOIP has taken shape.
Thanks, Sarah. Bob, would you like to speak?
I think I can do academics, but I'm more experienced in project management, where we actually implement stuff. But I'm thinking there may be some people who are attending this seminar who will be the decision makers and the implementers. And I'm just wondering if anybody in the webinar would be able to add any comments about their thoughts on what the process is now. We've got the research, which I see as a talk, being a little bit crude here, but we need to understand how that's going to be changed into the walk.
Yeah, the whole ethos of the HDRC is narrowing what's called the research implementation gap.
Sure. And I guess being very, let's say, impolite, there's no point doing research if nothing's coming of it.
Yeah, so I think the process doesn't stop when the thing has been created, but what happens next is the engagement with the audience to understand, okay, does this do what you were hoping for it, and how can we support it being implemented into decision making and action? And as you say, we have the huge advantage at the moment in that the 10-year local outcome improvement plan is right now being written for the new 2026-36 window. So there's, I mean, possibly the most opportunity to influence decision making exists right now. I hope I'm not misspeaking, Sarah and Miriam.
No, I think that you are right. Yeah, and this can be taken, especially when, as I said before, if you have to make a plan, a future plan, and you have different type of evaluation, different type of things that you can consider, maybe a way that you need maybe consider some research method when you want to prioritize your evaluation and look at what is actually feasible, considering the resources available, the timelines, or the mainly the resources in terms of money, staff, and time. I think that is quite important, but you need to have also as clear objectives and and outcomes and define maybe. And for each intervention or in each initiative, you can consider this scheme like what are the objectives, what I can achieve, what has already been known, and what I can, which kind of resources I can put in place.
Well, thank you. I think that leads us on to Martin Murchie's question. So Martin is commenting that one of the things that all local authorities face in evaluation is balancing speed, cost, and rigor. So we're in a fast-paced decision-making cycle with limited resources for evaluation. What advice do you have for right-sizing evaluation in that context?
Very difficult question. I don't think that there is such a thing as a right sizing, but I think that what you can consider is if you have maybe limited time and limited resources, you can again decide what can be achieved with that limited resources. And in some cases, for speed, as I mentioned, there are different types of systematic review or evaluation that you can conduct it. In some cases, you can opt for maybe, it's not maybe the optimal design, but because it's easy to implement and easy to put in place and doesn't require a lot of resources, is better than nothing. So you can use, like, for example, a before-after design instead of maybe a control group design, because the control group require much more resources, intense work, or you can use a rapid review instead of a full systematic review because you have limited time. So once you have decided your question, then you can, based on your resource and capacity, what is the best approach. But I think that you need to keep in mind this, and you need to have a discussion with the relevant people within your team and also with relevant stakeholder to find out the best way to make feasible considering the limited resources and time.
Thank you. Martin, did you want to reply to that?
Thanks, Nuala. Thanks, Miriam. I guess what I was trying to draw out was there's a huge spectrum, but when we're talking about evaluation, between multi-year, multi-million-pound academically resourced evaluations, and in a local government context, more fast-paced, realistic, resource-constrained evaluation. And what I think is important, if we're going to make a shift in the council in terms of how we operate, is really how we think about evaluation, how we plan what we're doing, how we know what questions we're going to be asking in order to understand the impact and the effectiveness of any particular intervention. So you're right, it's maybe not really about right sizing, it's, although they will vary greatly, it's trying to be consistent in the way we're thinking around our decision making.
Yeah, and especially if, as Martin, just to add on, this is also part of the Health Determinant Research Collaboration Aberdeen, but also this collaboration with academic institution, University of Aberdeen, Robert Gordon. This also, it's a possibility also to ask to find money and to maybe apply to research calls that nowadays there is a lot of NHR is definitely interested in improving also the way local authorities are functioning. And this is something, is an opportunity that we can consider working collaboratively.
Brilliant, thank you. Bob, you have your hand up again. I think it's again.
Yes, it's an easy question, but a difficult one to achieve. But it'd be very nice if we can do an impact assessment which looks at what's the added value to resource requirement ratio. Don't know if such a thing exists. If not, I've just made it up. So look at, well, you've got limited resources that you do when you're looking at what projects you want to implement. I'm talking about not in health, but in another discipline. So you've got limited resource, you look at what the maybe the top 5 things that will give you the most added value to fit to what resource is available. That could be a difficult one to quantify. I don't know if I have the answer, but that would be the ideal way of deciding what is best to implement, but also to identify which variables are not controllable. So there's no point in focusing on things which you can't control. It's just a waste of brain energy. Yeah, it's quite a difficult one, but we could almost do research onto that one, couldn't we? How to implement how to implement how best to implement the conclusions of research. But I'll shut up and I won't say anything more. So I've said enough.
You're welcome to say what occurs to you. That kind of leads us on to the last question that's been submitted in writing. So anyone who's still havering as to whether they want to put their in, the duration of this question and answer is what you've got to decide. So Martin Wiley asks about how to eliminate confounding factors when a number of interventions and projects are all targeted at the same overarching theme. Because of course, in a local authority context, a lot of interventions are proposed at the same time under that service strategy, be it the place strategy, housing strategy, transport. So interventions with the same ultimate goals are running at the same time. How do you deal with that? Which is a big question. I don't expect you to have a one-sentence answer.
No, I don't have a specific answer, but I assume that I know that they run at the same time, but I assume that this intervention will be different in kind of intervention, not the same type of intervention. So I think that because otherwise that doesn't make sense and is not a appropriate use of resources if you run the same intervention. So I assume that you have different intervention running at the same time, probably to reach the same goal or to reach a similar aim or objective. That is absolutely fine. The problem is that you need to consider for each one of these interventions that are not, maybe are similar, but not exactly the same, so they can have maybe slightly different outcome or effect. You need to consider for which one this, when I talk about the confounding factor, is to demonstrate the effect of an intervention. So your evaluation is to demonstrate, oh yes, with this intervention we have achieved this. But in order to be sure that you have achieved that kind of effect or impact, you need to consider whether there are no external factors that have contributed to reach that kind of effect. I don't know if, so it's something that you need to consider in the interpretation of your results. You cannot eliminate confounding factor, but you can take them into account, or you can consider, oh well, this intervention we have has demonstrated this effect. However, this effect was influenced by other factors that were running at the same time. So, for in a sense, so you cannot just say, oh, it's just due to the intervention. For example, I don't know, it's a simple example that is easy to understand. Again, if you want to have an intervention to reduce obesity, is a nutritional intervention to reduce obesity, for example, in school children. Again, you put in place this intervention, you assess the effect at the end of the intervention, but you need to consider other variables that children were exposed to. For example, they have maybe followed the diet, but there is maybe other children that they have increased physical activity, and we know that physical activity can affect the weight of people. So if you look at just the diet, maybe that the effect that you see is not just due exclusively to the diet, but is also due to other activities like physical activity that they have received. So you need to take this into consideration for all the type of intervention. I don't think that you can eliminate, but you can consider each one in a specific context and consider whether there are maybe factors that they can have produce or influence the result.
Brilliant. Thank you very much, Miriam. Pragmatism for the win. I don't see any other hands raised or questions. If I've missed something, please do shout. But otherwise, thank you very much for coming, everyone. I really appreciate it. I've enjoyed returning to this series, Learning Together for Better Lives. We will be back. We don't have a date yet for the next session, but what I'll do is when we do, I'll drop it in the chat for this meeting, so you'll get a notification of it. This is being recorded. It will be shared on the Community Planning Aberdeen website, and we are 20 minutes early, so I gift you 20 minutes of your afternoon back to you. Use it wisely. Okay. Thank you for coming, everyone. See you next time.